Hello and welcome to the channel. What do migraine headaches, fatty liver disease, high blood pressure, dementia, not to forget diabetes and kidney disease, just to name a few, all have in common? The answer to that is insulin resistance. I'm Dr. Kathy Shaw. I'm a Florida licensed chiropractic physician, a PhD researcher, and a professor of biochemistry. Every year, 10 million people die of cancer. 20 million people die of heart disease around the world. Another 50 million have Alzheimer's disease. Over 500 million people globally have diabetes. Almost half of all men over the age of 45 have suboptimal testosterone levels. 10% of women experience menstrual irregularities or infertility. Again, what do all of these disorders have in common? Insulin resistance. Insulin resistance is the most common health disorder worldwide. So to be able to understand insulin resistance, we first need to have an understanding of insulin, what it does in the body, how it works, how it functions. So we're going to start our conversation there. So like we said, we're going to start this conversation with how glucose and insulin act when everything's working properly in your body. So what happens is this. You eat glucose, and glucose is a sugar, and we have several different sugars. When we're talking about blood sugar, glucose is the sugar that we're talking about. Glucose isn't the sweet tasting sugar like we think of sugar being sweet tasting. When we think of sugar, that's fructose, so it's another sugar. But the sugar that we consume the most of is actually glucose. So what happens when we eat our glucose is we ingest it. It goes through all of our digestive processes, eventually getting to the point where we absorb it and it enters the bloodstream. So that's where the term blood glucose and blood sugar comes from. The purpose of it entering the bloodstream is for it to get transported throughout the body. So it goes through our digestive system, but we need glucose everywhere in all of our cells and all of our tissues. Because what that glucose does is go through a series of steps, reactions, processes to make energy for your cells, to fuel your cells to do whatever they need to do. Say a muscle cell to contract and get that muscle doing what it's supposed to do. An immune cell to fight off whatever bug it might need to fight off. So it's the fuel that becomes the energy for the cell to do what it needs to do. So we transport it to those cells through the bloodstream. So while that glucose is traveling through the bloodstream, what happens is the blood containing the glucose flows through the pancreas. That causes the pancreas to release the hormone called insulin. So insulin has a number of different purposes, one of which is to facilitate glucose getting into the cells. So what happens then is the blood containing both the glucose and the insulin comes up to the cell. And the insulin acts kind of like a doorman. The insulin will facilitate the glucose entering the cell so it can go through its steps to become energy for the cell. So it's kind of like the doorman opening the door for the glucose to get in. So the glucose gets in, you do your reactions, you do your stuff, and you form that energy that the cell needs. So then what happens is this: when we become insulin resistant, the first part of the process remains the same. We still eat the glucose. It still goes through the same steps and reactions to get absorbed by the bloodstream. The bloodstream still transports it. While it's transporting it, it goes through the pancreas. The pancreas sees that the blood contains glucose, and that causes the pancreas to release insulin. So now the glucose and the insulin come up to the cell, but if that cell has become resistant now, the insulin's not able to get the glucose in. So it's like the doorman's knocking on the door and the cell's saying, I don't hear you. So what happens is this: we continue eating glucose, it continues going to the bloodstream, continues going through the pancreas, we continue releasing insulin. So now both the glucose and the insulin go up to the cell. But now we have a higher concentration of insulin. That might just be enough now to get that glucose in. So we can operate a little resistant, by using more insulin to get the job done, get the glucose into the cell. But let's say then we become more insulin resistant. We do the same thing. Eat the glucose, goes to the bloodstream, flows through the pancreas, making us release insulin. The glucose and the insulin go up to the cell. Now it takes even more to get the job done. We get the job done with more, but then we can become more resistant. We can get the job done with more. And as long as we can keep making enough insulin to keep doing this and get the job done, we're operating in a way that appears normal. And what I mean by appears normal is our blood glucose levels still stay within a normal range because we're still able to take that glucose out of the blood and get it into the cell. However, we can reach a threshold. So at a point, we're making all the insulin we can. We've become more resistant. So now it's like 4 or 5 doormen still can't get that door open. So that's the point where we go from insulin resistant, because as long as we're making more and able to make the more insulin to get the glucose into the cell, we're insulin resistant. However, once we cross that threshold to the point where we need more, but we can't make enough more, that's the point at which we cross the line into being diabetic. And we know that because now we're making more insulin, but we're still not getting the glucose into the cell. That's causing then your blood glucose levels to rise. You keep eating the glucose, keep getting it into the bloodstream, but you can't get it out of the bloodstream into the cell. So when the blood glucose levels start rising, that's when we get the diagnosis of being diabetic. Some researchers believe that we're actually missing the boat on this. We're measuring the threshold, the point at which we become diabetic, as the point at which our blood glucose levels rise out of a normal range. We, however, know that the reason they're going out of range is that we're no longer able to produce the amount of insulin we need. Some researchers believe that our insulin levels probably started rising about 10 years before the point at which we became so resistant that we're not able to make enough. So if we were instead measuring insulin levels in the blood, rather than waiting until we're measuring glucose levels, we could probably have caught that diagnosis or caught that progression much sooner, caught it before the point at which we actually become diabetic. Now that we talked about insulin, like we mentioned, the resistance to insulin is the most common health disorder worldwide. A recent study showed that between 85 and 87% of Americans might be insulin resistant. According to the International Diabetes Federation, the number of cases of insulin resistance worldwide have doubled in the last 3 decades. They'll more than likely double again in less than 2 more decades. There are documented cases of insulin resistance in 4-year-olds. It's estimated that up to 10% of North American kids are insulin resistant. So how do you know if you are insulin resistant? That's what we're going to talk about in the next video, so I hope you'll join me for that.